With more community cases detected in Singapore, should tighter measures be reimposed?
Tan Tock Seng's hospital's COVID-19 cluster grows to 13, with 2 wards now in lockdown.
Electric scooter and e-bicycle riders, take note, you'll have to take online theory tests from the end of June.
Welcome to The Big Story, coming to you live from the Straits Times newsroom. I'm Olivia Quay.
And I'm Harian. To demand you can subscribe to the Straits Times channel so you never miss a single episode.
9 COVID-19 community cases were reported today, with 8 linked to previous cases.
There were also 15 imported infections, bringing today's count to 24.
Now, among the 8 linked cases, 4 were traced to the cluster at Tan Tock Seng Hospital. So there are 13 cases so far linked to TTsh, after 9 were identified yesterday.
Meanwhile, TTsh has taken measures to stem the spread, including locking down wards 7D and 9D, where infected patients had stayed. All close contacts of the cases will also be quarantined.
Clinical surveillance of all inpatients who may develop fever and acute respiratory infection symptoms are being stepped up, and all patients and staff in other wards will also be tested even if they're asymptomatic.
Staff and patient movement in the wards has been minimized to prevent cross-infection, and no visitors are allowed except for critically ill patients.
Elective cases have been deferred, and A&E cases that aren't life-threatening will be redirected to other hospitals as well.
Professor Teo Yik Ying joins us now. He is the Dean of the Saw Swee Hock School of Public Health at the National University of Singapore. Welcome, Professor. Prof. Teo, Singapore's first COVID-19 hospital cluster has grown to 13 people. How concerning is the situation for you?
Thank you for having me back. So yes, the COVID-19 cluster at Tan Tock Seng Hospital is worrying, since this is the first time a cluster has emerged within the hospital. And it should be highlighted that ever since the start of the pandemic, our hospitals have been remarkable in ensuring very little transmission happening within the hospital setting, from patients to healthcare workers, between healthcare workers, or between patients. So right now, Tan Tock Seng Hospital will proceed to swab test all the employees in the hospital, and not just those working or connected to the 2 wards that have been locked down. This is, after all, a hospital that, together with the National Centre for Infectious Disease, have been very much at the front of the front lines. And the healthcare workers have especially been trained to handle such outbreaks. And as such, this really serves as a reminder that even the best defense can be breached. And we now need to understand how and why, and then to make sure that this doesn't happen again. Singapore's approach throughout the pandemic has always been one that is humbling and pragmatic. We never think that we can get it right all the time. There will be some mistakes made and some policies that we need to tweak along the way. But if we know that there are gaps, we make sure that those gaps are plugged. So really, in the fight against infectious diseases, especially COVID-19, we cannot afford to let our guard down and to think that we have successfully overcome the coronavirus.
Right. Well, the hospital is one of, several new cases that Singapore has seen. Right now, the new clusters seem to be contained at TTsh and the Westlite Woodlands dormitory, but the other new cluster involves an ICA officer with 7 other cases linked to him. MOH said transmission likely happened when these 8 people met for a meal. So, Professor, should tighter measures be reimposed for social gatherings?
So we have always said that meal gatherings are one of the riskiest social activities that we can indulge in with COVID-19 hovering around. And this is really why Singapore has been very cautious at relaxing the number of people allowed to come together for social activities. If Singapore has allowed 10 or 12 people to come together for meals or other social activities, one infected person can potentially spread to 9 or 11 others. And this is really why we have been reluctant. However, I do not think that we need to reimpose tighter measures for social gatherings just because we have seen this one cluster. What is important at this stage is to make sure that all the contacts of those infected people are now identified and quarantined. And even those who know that they may have been in contact with those quarantined also monitor their own health, or perhaps even go on a leave of absence temporarily. And I think this is how we minimize any secondary or even tertiary chains of transmission. But we do not need to re-tighten our measures just because of this current one cluster.
Professor, several of the recently reported cases were fully vaccinated and had mild symptoms like we saw in the TTsh nurse, or no symptoms like the cleaner at the Tuas South Community Care Facility. So what's the mindset vaccinated people should adopt when they develop symptoms associated with COVID-19, however mild they can be?
I think we have heard time and time again that it's very important that people know that vaccination can reduce your chance of being infected, but vaccination can never completely prevent you from being infected. So in other words, someone who is vaccinated can still be infected, especially if he or she is working or living in an environment where the risk of being exposed to the coronavirus is high. So no matter whether you are vaccinated or not, if you develop symptoms that seemingly feel like COVID-19, such as a fever, dry cough, or unexpected tiredness, or even loss of taste or smell or sore throat, please avoid going to crowded places or even going to work. And if your symptoms persist, give your GP a call before visiting him or her. And those who have yet to be vaccinated, please do not see this as a sign that vaccination doesn't work. Vaccination works very well. And globally, we have seen how vaccination has actually worked tremendously well and successfully to cut down the number of transmission and hospitalizations.
Well, Professor, we know community cases are on the rise. 16 reported yesterday, a 9-month high in local numbers. Most have been linked to previous cases, but what's more worrying are the unlinked cases, right?
Yes, because the unlinked cases are really the ones that reflect something that's happening in the community, but we don't actually know what is wrong and where these cases are coming from. And those are the worrying ones. So when we know that cases are linked, we can actually proceed to perform the contact tracing, isolate and quarantine those who have been exposed, minimize those movements and interactions with other people in the community. So even if we do have a few cases who subsequently spread it to their contacts, we stop any further spread through our contact tracing, our isolation and testing protocol. But the problem comes when we have unlinked cases, because it means that there are multiple fires that are burning in the community to start and trigger these unlinked cases, but we don't actually know where these fires are and how the people are getting infected. And this is actually why the travel bubble between Singapore and Hong Kong is very much dependent on the number of unlinked community cases, rather than simply on the number of community cases. The unlinked community cases actually provide a much truer reflection of the situation in the community. So at the moment, I would say that the situation in Singapore is worrying, definitely, because we are seeing more cases than we are a month ago, and we need to be on our guard. But I will put aside any fears at this point in time that we will return to another circuit breaker situation.
Professor Teo, thank you as always for coming on the show and sharing your insights with us. We've been speaking with Professor Teo Yik Ying, Dean of NUS's Saw Swee Hock School of Public Health.
Cases in the migrant worker dormitories had been close to zero for months, and plans were in place for rules to be relaxed. But a recent flare-up at Westlight Woodlands has thrown a spanner in the works.
1 year on since COVID-19 swept through the dorms, multimedia correspondent Renee Poe looks at how life has changed for our migrant workers.
In April 2020, Singapore was scrambling to quell the outbreak of COVID-19 in its migrant worker dormitories. 1 year on, while the situation has been brought under control, the timeline for workers to return to the community remains unclear after a spate of dorm cases. The Straits Times takes an inside look at how the living conditions in the dormitories have changed and how the workers have adapted to life within confinement.
So when we come back 7, then we need to cook, take 1 or 2 hours. Today we cook vegetable, then later we put the rice. Every week we cook meat twice. Then most likely around 9, 10, 10:30 we all going to sleep ready. Some of them wake up 6 o'clock, then heat up their curry, then prepare for the morning breakfast and the lunch. So around 7, 7:30 we leave from room ready. When we go out morning, we need to scan out here. Every room got a scan out one.
About 100 workers live in Kwan Ai Kong Construction's temporary construction site quarters at Jurong Lake Gardens. This is half the number who were staying in a factory-converted dormitory at the start of the pandemic. As the workers work and live on site, many have not been out since the lockdown.
Previously have freedom. We anyhow can go outside, we can meet with our friends, but now we cannot meet with our friends, so sometimes miss our friends, but we can phone call, video call, we can contact with them. Starting time we feel something uncomfortable or whatever, but now we feel comfortable because habit. So far I am happy if compared with other dormitory, because dormitory is very narrow place, but here are open space.
Despite the number of COVID-19 cases in dormitories staying close to zero for months, the recent flare-up at Westlight Woodlands has pushed back plans to relax rules. It remains to be seen when migrant workers will be able to travel freely again.
Wrapping up the big headlines for today. From June 30th, all electric scooter and bicycle riders will need to pass a mandatory theory test first. This includes those who are already using these devices. The Land Transport Authority said the online tests will comprise multiple choice questions with more details to be provided at a later date. Handbooks have been published online and will cover 3 modules like pre-journey and equipment checks, as well as rules and codes of conduct.
After more than a month, Chili Api Catering suspension over a gastroenteritis outbreak was lifted today. The Health Ministry and the Singapore Food Agency said the firm had complied with SFA stipulated measures, even as authorities are still investigating the cause of the outbreak. Between March 10th and 13th, 129 people who ate food prepared by Chili Api Catering were reported to have gastroenteritis.
DBS Group trumped market forecasts with a 72% jump in Q1 earnings. Net profit for the first 3 months of this year rose to $2.01 billion. The first time quarterly earnings crossed the $2 billion mark and the first growth in more than a year.
Well, looking overseas, at least 44 people, including children, were crushed to death in a stampede in Israel today. The incident happened while tens of thousands of ultra-Orthodox Jews gathered for a religious bonfire festival at the pilgrimage site of Mount Meron tomb. Witnesses said people were asphyxiated or trampled in a passageway, with some going unnoticed until the PA system sounded an appeal to disperse.
From today, vaccination centres in Mumbai are shut for 3 days due to a shortage of vaccines. India reported over 386,400 new cases today, another record high, and close to 3,500 more people have died. Medical experts, though, believe its actual COVID-19 numbers may be 5 to 10 times greater than the official tally.
Hong Kong has reported its first untraceable local infections of the highly transmissible N501Y COVID-19 variant. They are a 39-year-old domestic helper and a 10-month-old baby girl living with her.
Meanwhile, New York Mayor Bill de Blasio said the city hopes to fully reopen on July 1st. The mayor did not specify how or when restrictions would be lifted, but told MSNBC that the Big Apple is ready for stores and businesses to open. Restrictions have loosened in recent weeks, with restaurants, stadiums, cinemas and performance venues now operating with limited capacity. But Broadway theatres aren't expected to reopen until September.
Well, those are our top stories for today. For more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below.
Once again, I'm Haryanto Diman with Olivia Kwe. Have a good weekend and we'll see you next week.